This is Oklahoma's own News 9.
Some doctors and nurses say they are crumbling amid another wave of COVID-19. The State Department of Health says 1,607 of our friends and neighbors are hospitalized with the virus.
SSM Health reopened its COVID ICU to help just keep up with this outbreak, and they let in News 9's Erica Rankin.
SSM Health has opened the door of its COVID-19 ICU to me twice. The first time was back in December. Back then, nurses were worn down, but hopeful with the vaccine coming down the pipeline. This time, hope is slowly fading as the patient count is just as high as 8 months ago.
Literally, before you guys just came in, we intubated 2 people.
This is ICU nurse Amy Pettit. It's her second time walking me through the hallways of her COVID ICU.
As you notice, our IV poles are back in the room.
This is what the ICU looked like back in December compared to now. And the feeling inside 8 months later, eerie.
Unfortunately, the patient that was in this room passed away this morning.
As a stretched staff works to provide a high level of care to the sickest people with COVID-19.
Like this patient's prone in bed. On the ventilator.
Amid this wave, emotions are at an all-time high among healthcare workers. Pettit telling me it's her privilege to be next to a patient, saying their final words or taking their last breath. At the same time, though,
I'm tired of listening to people say goodbye over a phone call, telling their loved ones they love them as I'm holding their hand and they're getting ready to go on the ventilator. I'm tired of listening to those conversations, really.
In the past 30 days, hospital admissions among those unvaccinated for COVID-19 is around 2,200. Admissions for people fully vaccinated is just under 200, calculating to just shy of 95% of people in hospital beds being unvaccinated.
Most patients who are on the ventilator, they will not survive, unfortunately.
Dr. Mohammed Ishaq, a veteran critical care specialist, says he's never seen a disease cause such severe damage to a person's lungs like COVID-19, especially now in the much younger patients they're seeing.
It's very hard because a lot of these patients, they are relatively very healthy, younger patients who had a reasonable life expectancy, and now they're critically ill in the ICU. And their chances of survival are also very low. So it's really very hard.
We have a girl in her 20s right now that's been on the ventilator a week, and we can't find her an ECMO bed. We're waiting for one to open up.
Both urging people to get their vaccine to not be a statistic of COVID-19 and to help them get through this pandemic once and for all.
At the end of the day, you have to have hope. You have to have hope in your fellow man that they will do the right thing and that we will care for each other and they will hear what's going on in our hospitals, that we do need the public's help getting vaccinated, masking up, and just helping us because we're tired and we're stretched thin and it's not sustainable.
SSM Health has 3 units dedicated to COVID. They have no available staffed ICU beds. 53 people are on the waiting list. 4 patients in the emergency room are also waiting for beds. Erica Rankin, Oklahoma's own News 9.